welcome back. You're watching continuing coverage of the World Healthcare Congress 2017. We're coming to you from Washington, D.C. And in our studio this morning, we have Mary Picerno, who is Chief Nursing Officer, Consumer Health Engagement at Cigna Corporation. Now, Mary, you oversee and lead more than 2,000 Cigna nurses and other healthcare professionals within the Cigna family. What sort of team-based strategies do you deploy to really manage such a big area of the organization?
Yeah, that's an important question, so thank you, Mabel. Cigna uses a patient-centered, multidisciplinary care team approach in a few different ways, but primarily for managing the high-cost, high-risk, catastrophic population of customers. And the reason for that is they're heavy utilizers of the healthcare system. They have multiple comorbid conditions, often a behavioral health component there as well. And the special nature and the different degrees and specialties of the multidisciplinary team are really a great fit for all the complex needs of that high-cost, high-risk population. So we, in the application of case management and with the multidisciplinary team, we use a lot of industry standards and best practices, if you will, to deliver that process. They serve as sort of guiding principles as we go throughout the process. And we use the Institute of Medicine's 6 aims for improvement, and they are to make sure that healthcare is delivered safely, effectively, in a patient-centered way, timely, efficiently, and also in a way where there is equity. And by equity, I mean making sure that healthcare is available to everyone, regardless of their socioeconomic status. They should have access to quality and affordable healthcare. Another one of the guiding principles that we use in the multidisciplinary care team approach is to use the CMSA, or Case Management Society of America's 6 pillars for case management, as a foundation. And that is to assess the patient, to care plan, to implement that care plan, to coordinate, monitor, and evaluate the ongoing needs of that care plan so that you can make sure as the patient's needs are changing, the care plan is keeping up with that. And then the last thing I would say is, it's important to think of the customer or the patient as not just a diagnosis or a collection of ICD-9 or CPT-4 codes. It's really important that you approach the case management process holistically if you really want to improve health outcomes. And so there are really 6 domains of health that really need to be considered when you're focusing on improving outcomes. And those are physical, mental, social, spiritual, emotional, and financial. And just a comment on the financial piece, because I can tell you in our own experience, the population that we're dealing with that's so high cost and so high risk is dealing with a lot of out-of-pocket expenses, co-insurance, deductible, co-pays, and their health is impacted by their disease, so they may not be working full-time, and they're worried about dealing with household issues, managing the household. The finances are a burden. So if we don't give them strategies and information about how to manage through the financial piece of this, they really don't have the capacity to really want to take in the information that we're sharing on health improvement.
How challenging is it to find the right team of clinical specialists to really address the different aims that Cigna has put out there? Because there are quite a number of goals that the corporation is trying to meet.
There are, and I would say, it's really sort of a combination of bringing the science of medicine, the art of case management, and a collaboration model together to improve those health outcomes. And there's a lot of information actually out there online about all the different uses a multidisciplinary care team can provide in terms of health improvement. It's also supported by the World Health Organization as a care model as well. But I would say at Cigna, we have over 2,000 US-based registered nurses that have advanced degrees, specialty certifications, and experience. And in addition to that, we have physicians, nurse practitioners, pharmacists, dietitians, social workers, exercise physiologists, respiratory therapists, behaviorists, non-clinical support staff. It's a very large multidisciplinary team to address the diverse needs of the population.
What are some of the takeaways that you want to leave with the attendees? You're speaking on 2 panels, one today and one tomorrow. What are your messages?
Well, health improvement is absolutely key. It's the only way to really improve a person's quality of life. It's the only way to really try to manage healthcare costs. Everything needs to be completely patient-centered, and the provider, the health plan, and the customer are really a care team unto itself. Communication, collaboration, and really being patient-centered is the key to health improvement.
Okay, Mary, thank you so much for your
You're
time
welcome.
today. We're so pleased to have the chance to
Thank
speak
you.
with you. Actually, I should ask you, this is your first time
It
here
is.
at the meeting. How are you finding the experience so far?
Oh, it's incredible. It's an amazing opportunity for networking. The tracks and keynote speakers and topics are phenomenal, and I'm very impressed at how well organized everything is.
It's great to hear. All right, thank you, Mary.
You're welcome. Thank you, Mabel.
And thank you to you for watching. Stay tuned, much more coverage to come.